Okay, it's now 1 minute past one. Feel free to settle in. We'll start with introductions. I'm joined today by my colleagues, Gideon and Rob, who I'll introduce properly and formally in a minute. But we are all here to discuss men's health and men's health in the workplace in particular. We're really happy that you're been able to join us today. And whilst you're getting settled, I'm going to share a few housekeeping points. As you can see, the webinar is being recorded, meaning you will get a recording after this call. If you have to leave or one of your colleagues couldn't have joined, we will circulate it. This also means that people might be seeing it. So we remind you not to use any identifiable information that you wouldn't want to be sharing. You can use the Q&A option if you want to ask questions. We really want today to be as informal and conversational as possible. So feel free to interrupt, feel free to ask questions. Make sure that you tick the anonymous box in the Q&A if you want your questions to remain anonymous, or please send comments down the webinar chat as we're going. We'll have plenty of time for Q&A at the end as well, so we can also answer your questions there. By way of introduction, I am Celine. I'm your Fertifa host for today with two of my co-hosts. I'm the Director of People and Operations at Fertifa, and like many of us at Fertifa, I have a journey, let's say, with reproductive health. Having also been a Chief People Officer, I've experienced reproductive health from a workplace perspective, and hopefully that will give me some unique insights to share with you today. If you're new to Fertifa, we're Europe's most comprehensive reproductive health benefits provider, and we help employers like Meta, Sony, Lululemon provide more inclusive workplaces for their employees. And hopefully through today's webinar, you see an example as to how we achieve that. So introducing my colleagues now to help educate us on the topic of men's health today. I'm delighted to be joined firstly by our medical director, Dr. Gideon Lieberman. Gideon, if you would like to introduce yourself.
Hi, everybody. Hello. My name is Gideon Lieberman. I'm the medical director here at Fertifa. I'm a consultant gynecologist and specialist in reproductive medicine surgery. So not obviously male health, but I have significant interest in male health as part of the my fertility work and journey into midlife myself. I've helped structure the men's health processes at Fertifa, and it's going to be quite interesting to sort of have a discussion today, and I hope we can all engage in a discussion today about men's health. One of the issues that I think everybody faces who's involved with looking after men is the engagement of men in looking after their own health and discussing their own health. And I get it from a industry perspective. I get it from a medical perspective, certainly from a fertility side, but I also have it from a personal perspective where I'm a bit icky about it as well. So hopefully we'll be able to maybe flesh out some of these points during the chat.
Thank you so much, Gideon. We're also joined by Rob Notley, who works on our sales team. And I'm really excited to have Rob with us today because Rob has been very active in helping shape not only our men's health policies, but even our women's policies, such as pregnancy loss for individuals. So Rob, if you'd like to introduce yourself.
Yeah, thanks so much, Celine. I was actually just being a little bit nosy and just looking at the attendees, and it's amazing to see some of the people that I've had the pleasure of speaking with in recent months. So, firstly, that's amazing. For everyone else that doesn't know me, I am responsible for sort of helping lead the commercial team here at Fertifa. So I have the wonderful job of speaking to all different shapes and sized organisations about how they can better support their employees within the workplace. So men's health is a big one that is a topic that is on a lot of people's radars right now, and rightly so. But I think just to go back to the point you mentioned, Celine, the reason that I chose to, I guess, be within the sort of reproductive health benefit space was because I've been through a couple of journeys myself that I would foresee as not really being supported. So I can see the value in terms of making a difference for others, which I think is super important. And yeah, really excited about having the chat, getting into why men's health is really important in the workplace and what more we could be doing as well. So yeah, thanks everyone for joining. Super excited.
Thank you so much, Rob. So before we actually start, we love data at Fertifa. So if you'll indulge us with a couple of polls, we'd really appreciate it. I'm going to launch the first poll now, which hopefully you can see on your screens. And I would really appreciate if you took a few seconds. The first question is, have you ever considered implementing a men's health policy? Yes, no, you may already have one, which would be amazing. Number 2, how important is introducing men's health support for your business in 2025? 0, not important. 5, very important is the rating scale. So I'll give you a few seconds. We have more than half of people who have voted, which is amazing. And then we can discuss the results. Okay, we have 70% almost, maybe a few more votes so that we are... Oh, we've had a few people join in the meantime as well. So, I mean, let's have a look at the results. So first question, have you ever considered implementing a men's health policy? It's really great to see that more than 60% have said yes. Interesting as well that no one has said they already have one. So hopefully we can help you with that today, as we'll be sharing a handy link to download one of our templates. But yeah, so very encouraging that you have considered it. Number 2 is much more varied. How important is introducing men's health? So half of you said very important, so 5, 23% 4. So yeah, I can see that we have some very engaged participants. Any comments, Gideon, on the results that you see?
Thanks. I think it's interesting that that people want to look forward to having a men's health process in their companies. I think it's part of the overall view of looking after people, and you can't get away from the fact that men's health is a little bit under the radar, and it's interesting, and I don't know why that is. I think it's a lot to do with engagement, but I'm pleased to see that a lot of people want to introduce that. The thing that bugs me about it, and I keep on coming back to, is how much that we can't take men in isolation, and men's health affects women's health, affects families, affects businesses, and you can't just look at one disease process or one group of people and think it's not going to affect other things, because we always talk at Fertifa about the interrelationship between different aspects of people's lives and relationships and how it all fits together, and you can't just take one bit out, so you have to look at it all, and men's health is a very, very important bit. I struggle with it because it's really important, but where I struggle with it is the engagement of men into men's health, and I just wish I could flip a switch and make engagement a bit better, both with the company, myself, everybody. I just wish there was a little bit more engagement in it. And somebody flipped something to me yesterday about a men's health strategy from the government, which I think is a good thing.
Right.
So yeah, I'm really pleased that people are doing it.
It's really interesting what you say, because we know, from a survey done by Gillette, for example, that 75% of men, which is a really high number, 75% of men will put off going to the GP when something is wrong. So I'm really keen to discuss that a little bit further. But before that, Gideon, it would be super helpful for people attending, and I know it was helpful for myself, even when I joined Fertifa, to discuss what we mean in terms of different men's health conditions, because that's also part of having a policy, is educating everyone as to, the different things that could happen through your reproductive health journey. Could you give us a few examples?
Yeah. So when I was talking to my sons, got 3 sons, and my friends and colleagues about that, I got different answers to what people viewed about men's health, and really interesting. And I think there has been a societal change about health and how we view health, and an important part of, if I speak to my friends, so I'm in my mid-50s, but don't tell anybody that about men's health. What bothers my friend's health is prostate cancer, prostate symptoms. That's what bothers us, okay? The other thing that bothers us is sexual health, infections, performance, erections, ejaculations. That's important to us. So there's that aspect of it. But actually, more importantly, or as importantly, or very importantly, is cardiovascular disease, which is the biggest killer of people over, or men over the age of 65. So it accounts for most deaths in men, where we should be looking. And as I talk a lot, Fatifa, about the interrelationship between cardiovascular health and reproductive health. Maybe we can explore this a bit later when we get into some details, but there's a huge relationship between reproductive health and long-term cardiovascular health, very important. And then in younger men, and this is where I've seen a sea change in how people view men's health, because when I was a younger man, I would never talk about erections, sexual problems to my friends, never mind a stranger. And that has changed. And then when I talk to my own kids who are in their early 20s about men's health, their discussion is around suicide. And because we know that suicide, self-harm, suicide, biggest cause of death in men under the age of 35, excluding cancers. You know, massive problem. We all know somebody who's unfortunately you know, decided to end their life early, and it's truly horrific for families and friends. And so I think men's health is really, it's different at different ages, and just as in women's health, different at different ages. But I think what I'm trying to say is the knock-on effect from men's health then goes on to relationships, work, families, everything. So you can't take it out in isolation. So different things at different ages.
Yeah, no, thanks, Gideon. And speaking of young men, hopefully you don't mind, Rob, that I speak to you in those terms. But as a young man, I'd be really interested in how, you know, what Gideon just says resonates, but also secondly, as a professional who speaks to, you know, HR people, you know, how important is men's health on the agenda? So 2 questions for you there.
Yeah, so I'll lead with the second one first, actually, because like I said earlier, I get the opportunity to speak to all different shaped and sized organisations. Here at Fatifa, we focus on quite a lot of different areas, as sort of Gideon's already mentioned, from a reproductive health perspective. So whether that's fertility, whether that's menopause, whether that's women's health. A lot of the time, I'll find organisations are coming to us, for example, to speak specifically to fertility or menopause. And then once we actually start taking them through the other areas of reproductive health or health in general that Fatifa focus on, the sudden realization from a business or HR manager is, oh, wow, but we're considering doing all this, but we are maybe forgetting about supporting men in the workplace. And I think that seems to be a real general theme. It seems like men, in some instances, may sort of come at the bottom of the pile when it comes to health. And I think that's just the stigma and taboo that sort of sits around men's health in the workplace. It's the way it's been for a while. We're certainly starting to see that shift now, and a lot of HR managers focus on it, which I think is really, really important. And I guess it goes back to sort of what Gideon mentioned earlier in terms of sort of engagement of men. Like that's the big hurdle that I think a lot of people are trying to get over, is how do we get men to interact with something in which they can access that support. And I was just going to I'm going to deviate a bit, and I was just going to throw it back to Gideon. How I always talk about health in the workplace, but just in general, is I sort of position it against what a female's journey would look like through the healthcare system. So I feel like females from a very young age have a lot of touch points with the healthcare system when they're growing up. But for men, there's not really anything until you reach a certain age where you may be invited in for a specific screening when you're sort of a lot older. So I think that sort of resembles back to the lack of engagement. I just don't think we as men are used to or feel comfortable necessarily speaking to GPs and doctors. It's just we haven't really grown up with it. But I was going to open that up to you, Gideon. Is that something you would sort of agree with in terms of the touch points? Men just typically don't have them, so they're less inclined to do so.
Absolutely, and I suppose well, first of all, it's a cultural thing, but also a male thing. In that the biggest reason, the two main reasons that women will go and see their general practitioner or interact with general practitioners is not getting pregnant, being pregnant, and then the problems afterwards. So these reproductive challenges that women encounter, men just don't. We just, as you say, we don't do it. So we keep away traditionally from doctors and GPs unless we really have to. And the health service, our health service, is very reactive to health. You've got a problem and then you go and get it sorted out. And proactive healthcare, for many, many reasons, in this country hasn't really been promoted. And it's been vaunted, but it really hasn't been taken on. And we all know about the health messages. And the question is, why don't we take on these health messages? And I think it's something that maybe we can discuss at a later stage. But absolutely, when I turned 50, I thought, wrongly, that I was going to get a little message from my GP saying, well done. And now we would like to invite you in for a health check, a cholesterol check, a PSA test. Actually, I knew I wasn't going to get PSA, but a cholesterol test and a discussion about lifestyle to see how the next 20 years are going to go. And it didn't happen. And I thought, I don't need it then. Because if your doctor doesn't contact you like a bloke, I don't need it. But you don't call it me, I probably don't need it. And it didn't happen. And then I had to go out and, arrange these tests, which they were happy to do, I have to say, but they weren't proactive in it. And actually I found out I did have high cholesterol. And and so I don't think we do. And in the UK, there is no prostate screening. Let's not forget this. I mean, it's been much in the news recently, but there is no prostate screening at all.
That's so interesting.
So
Because you're a medical director, right? So you know that you would be expecting to be contacted, but I think someone who's just going about their decades and doesn't have any issues or doesn't have any visible issues wouldn't even have that expectation to have someone reach out to them, and then wouldn't actually go and do any of these tests. So
yeah, I wouldn't. I mean, if I just hadn't thought about it, if I hadn't been in the industry, the medical industry, I wouldn't have done it. And I have to say, most of my colleagues in medicine of my age don't do it. And I was only just really being quite proactive about it. And as you say, Rob, we don't have these touch. So, there is the bowel cancer screening later, but there is no specific male. And the question about why that is, I think it's interesting, but there isn't. So we've
had a question in actually.
Yeah, sorry.
Which is a good time for that. But is there actually a reliable method of screening for things like prostate cancer?
That's a really good question. It's much debated, but very simply, no. But very simply, no, there isn't a mass screening ability to look for prostate using PSA. There is a way of screening using PSA and a type of MRI, which would be effective in a mass screening for men point of view. But it's expensive and there's a cost benefit to it. There's cost benefit obviously to the individual, but to the nation it's a big question. So if we do PSA screening, we'll find the PSA, which is a blood test, prostatic specific antigen, is raised in a lot of men for not cancer reasons. So it's not very specific. However, it doesn't, there is a difference between doing a blood test and a difference between a questionnaire about your health, including prostate symptoms that could be further investigated. So there isn't a foolproof. Thanks for that. There isn't, but it doesn't mean we shouldn't look into it a little bit more.
Yeah. And we know, from the surveys and the statistics that employees more and more, are turning to their workplace to help navigate health issues, reproductive health issues, mental health issues. So, I think, having a policy is not just to have a policy. I think it starts the conversation around men's health in general. And going to Europe, I was just curious, was Fertifa the first place where you've had a men's health policy? Did you have a men's health policy in other workplaces? How did it make you feel? Whether you used it or not is a different matter, but how did it make you feel knowing that you had a policy in place, or that you have a policy in place?
Yeah, really good question. So the first place I've ever had a men's health policy. But how did it make me feel? Well, what it did do, I think we managed to get quite a few men in the business to come along to that and take part in conversation as to what we would expect and what we may like to see. What it did do is it felt like it gave me a voice in terms of really letting me understand what I felt like the business could do to support men going through specific journeys in more detail. Like I said, I've been through a couple of journeys, so I've been exposed to maybe what I feel. I don't think there's an expectation for necessarily an expectation for an employer to do something, but I think it's leaning more towards that way. But it would just be nice to feel comfort in if I were to be going through a specific journey, I know exactly what I have to do to maybe go along that journey from a business standpoint. How do I communicate that to what does that look like internally? It gives me so much reassurance as a man. But what I would go back to when I said a few people sort of took part in those conversations, we all just said how it was like a breath of fresh air to all be sort of talking about what we're going through, sort of men's health in more detail, just openly between ourselves. Like we all admitted we just never talk about it. I always go back to the point about if I have a health issue now, I'm even really reluctant to speak to Rachel, who's my partner, about it. Like I don't know why. But it just we all would agree that it just felt amazing to be sort of talking through that, all being super open. And I think we just need to encourage it more. And I think having a policy in place has allowed us to do that. Like I feel comfortable going to my manager now, being quite specific, without being too specific about what I'm going through. But I have confidence in talking about that, and the policy has given me that to be able to deliver that. So, yeah, real positive impact, I think.
Thanks for sharing. And obviously that's what we wish for all, our clients or people that we speak to and we work with. And I think what you're really referring to here is also having that psychological safety in the first place, right? Because you can bring together a group of people, but they could also not share anything. So the fact that you felt that you could share is really important. So going to you, Gidon, how do you think workplaces or maybe leadership even can make sure that they're creating this psychological safety for people to be able to share what they're going through or ask for more or ask for change?
I think that this is I think two aspects to this. I think if it's from a leadership thing, I think that, and I think it's really difficult. I kind of think people who are in leadership, who are men, need to acknowledge that they have health and medical issues. And that feels really uncomfortable as a man. And I think it would feel very uncomfortable if you're a man in leadership, because maybe it's an old-fashioned viewpoint, but I could see that a man in leadership would view that as weakness and inability to be a leader. And I think that's really difficult because you don't want to appear to be, I'm not going to use the word weak, but I don't mean it. And actually acknowledging health issues is a demonstration of security and strength, and is separate to your ability to lead a company or a group of people. So I would like to see examples like Chris Hoy of people coming out and talking about issues. And there has been a sea change in this, and that we are much more likely to see people in the media and sport talk about their struggles with mental health issues or with physicality. I think the issues around reproductive health and leadership are that it's all these concepts of men being fertile, productive, strong, alpha even. And anything that detracts from that would be seen as a mark of weakness and an inability to lead, which, as I say, I think is actually the strong thing, is turning towards the difficulty and saying, these are the problems that I've had.
Yeah.
And
So
this is how I've dealt with it and overcoming. I
amazing.
think like women in the sorry, I say it was delayed there. Sorry, were you going to say something, Celine?
No, it's okay. Continue. I was just going to say, so essentially turning vulnerability as, a tool of empowerment rather than seen as a weakness, essentially.
Yeah, absolutely, and overcoming and not overcoming, but managing. And I think that an acknowledgement is that I've never met a human being that didn't have a health issue. It's part of being alive. And understanding that those health issues come in different shapes and sizes is part of being alive, and actually understanding people. And actually, I suspect leaders that do acknowledge and do discuss their own, not specifics, but challenges, would be viewed by their employees as a lot more human, and the bonding would be better. I think within the workplace, and we have previously on our women's health issues encouraged we use the word champions, but I don't mean that. I mean a focal point for discussion.
Yeah.
And whether there is a concept in men's health that would be similar, that I don't want to use the word champion, but really a focal point for coordination of discussion around men's health. Just even if it's just signposting. And
Yes.
that's kind of how I want to. The other thing I just want to bring up, and I'm sure you're going to bring it up later, Celine, is the fact that you have to have equality in life. And if you're going to have a women's health policy, then it seems weird to me that you don't have a men's health policy, you don't have a gender neutral policy, because this is how we live.
Absolutely.
And it seems that this concept of equality has to be encompassed when making policies. So I think there's a couple of things there, but sorry about that last point. It just dawned on me when I was talking before.
I think everything you say is so true. And, I think it actually answers the question that if you do happen to have a leadership that maybe does not have someone who feels comfortable to share how they feel in terms of the challenges that they're going through from a health perspective, you can have ERG groups, so employee resource groups, which is what we did to create our policies. You can also have champions. The trouble with champions that we found is that, as you say, Gidon, that word is a bit tricky, because I also think sometimes people don't want to be the it person for a specific issue or challenge, within a company. Oh, this is the person for gender identity. This is the person for, I'm pregnancy loss, or whatever that is. So I do think that having ERGs is a really great way to create some lasting change in companies. So I wanted to turn to you, Rob, and reflecting on, you've done a few ERGs with us now. I think you've done pregnancy loss, you've done men's health. We really want this to be a long-lasting change. So how can we make sure that, we keep the conversations going away from just that one meeting, from your experience?
Sorry, just trying to find the unmute button there. Yeah, I think we're really good sort of internally at posing the question to when we need support, we can bring groups together, and I think that's super important. So I'm obviously pretty happy to sort of be a leader internally and sort of bring the sort of ERG together and work out what we can do. I know you sort of as a people team, we'll often be reviewing those policies in line with best practice and what others are doing. So I think that's always really helpful. But like I said earlier, I think just the nature of having that policy in place makes all of us internally feel a little bit more psychologically safe in terms of speaking about this, and speaking about certain topics and things that we're going through, whether it is specifically relating to the policy or whether it's outside of that. So I think the biggest thing moving forward is, for me anyway, and I'm sure others would agree internally within Vetifa, is just giving me the confidence to express sort of my voice and feel more confident in terms of raising where I think the business could be doing more things maybe that we could be considering to make our policies even better. I think before having that policy in place, and certainly where I've been previously, in terms of other organizations, I genuinely just don't think I would have had any confidence to sort of speak up.
Right.
And I think the policy has given me that to feel more confident in talking about men's health in the workplace, because it is still very taboo.
It is absolutely. And I think a lot of the times, whether we're talking about men's health, women's health, gender identity, there is a fear to get it wrong. You know, there's a fear to use the wrong words. There's a fear to say something wrong that might offend someone. And what we always say is that you really need to get it wrong to get it right. Just get started. Even if you don't really know, just get something going. It's never going to be the final form of a document. It needs to be living and breathing and be updated with people that join you, share their experiences, and help you upgrade essentially the policy. Having said all that, though, I did promise to share one of our templates. So I will share that in the chat. And so feel free to download that to help you get going. Our best advice is, you know, really tailor it to your organization, to your culture, to your values, you know, whatever works for you. But hopefully this gives you kind of a good starting point. So turning to you, Gideon, why is it so important to consider people's real life experiences when creating policies? I remember, and I know I repeat this every webinar, but this really stuck with me when we first met, Gideon, is, you know, I've been very open about having pregnancy loss. And one of the things you always told me is, you know, not to assume what somebody else is going through, even though I think I may have gone through the same thing. So bringing that back to writing an inclusive policy, how important is it to consider, you know, people's realities and practicalities?
Yeah, thanks for that. I think I would sort of write this using a group of people who have had issues. Okay, I know it sounds weird, but I wouldn't draft the policy on their experience of those issues. So I would find out what people have been through and how much people have been through, and very generally how they managed it, but probably more importantly, how they would have liked to have been managed or it managed in a passive sort of way. So how would they like to be looked after? And that's probably where I would start. And I would, you know, think of the narrative of the story, the narrative of a person's journey, and talk to them about that narrative. It and from a policy point of view, I think it's a bi-directional thing. It's how does problem A affect on Rob, and how does that affect Rob's work? How does it affect him coming to work and his performance at work? But also the other way, as an employer, which is more important, maybe, is how can we affect the disease process that Rob's going through by our behaviors and messages at work. So I think about the story that Rob's going, sorry to use Rob. Think about the story that Rob's going through. So let's just say he's got an issue with problem A, how it's affecting Rob's work, and how work can affect Rob's pathology or Rob's problem. And then I would build up the story from there, just looking at known resources. I just think that the reason I would start with the people first is that your engagement with the policy will be higher because you're going to get people involved in the policy from the start. So this won't just be another policy in another folder. This will be something that Rob helped create because we've asked him about it, and he will use it and he will look upon it, hopefully. And that will also encourage him to talk about whatever he needs, has been through, to other people. So I think it's a win-win situation. So I would start with the story, but don't base the policy on how Rob directly was managed, because everybody's, as you said, Celine, everybody's experience will be very different. And I kind of think that's the other problem with champions, is that when you have a champion, you've got to be careful that their pathway isn't the only pathway,
Yeah,
which is hard, actually. Which is
it's
hard.
hard. Also, champions can leave, and then you're left with a really big gap, you know, to fill because you don't actually have a framework that supports it. But I really like what you're saying, because in every policy that we do have a personal plan included in it, because we're very cognizant of the fact that every person is unique, will go through different challenges, even with repeat challenges. you might have the same thing, you might experience it in a different way, you might need different things. And so we almost leave it to the employee to kind of pick and choose what they might need. They might need time off, they might need flexibility, they might need to work from home. It is different in every case. And that's really an important part of the policy. Do you agree, Rob? What do you think about, I guess, the different variables? I know, speaking probably to HR people, one of the things that come up a lot is people ask, okay, how many days should we give off? Should it be paid or unpaid? What are sort of the things that you hear in conversations that you think might be useful for people thinking about creating a policy?
Yeah, so it's an interesting one around mental health. Like, again, I think a lot of people are trying to think of the best way to put it, probably unsure from a leave perspective and just how much detail to specifically go into. I think that's the biggest hurdle for most people I speak with in terms of HR teams that are creating the policies is what do we actually include within the policy and how much detail do we actually need to go into? And I guess off the back of that, that then correlates into amount of days that we're going to give for leave, etc., etc. I also think it's quite a tricky topic to address. Like, I think if you look at some of the other policies that we've sort of looked at, whether it's like a baby loss policy, for example, I think it's not easier, but I think there's a bit more of a direct approach to leave associated to those. But again, for men's health issues, I think it's harder to put a number of days on that, and I think that's what I get asked the most is, can you suggest? And it's quite hard because it is so varied. I think it's a bit of an unknown spot at the moment as to how much leave we should give to specific areas of mental health and how much detail to go into.
Absolutely. So our best advice is to keep it open. You may want to start with a few days. You say you can have, let's say, 3, 4, or 5 days, but if you feel you need more, then speak to your manager, speak to your HR, speak to whoever you feel most comfortable. And we found that that's probably what works best, because it's wrong actually to be prescriptive just because you just don't know what people are going to need. But it was actually interesting because in our ERG, 5 days was the number of days that kind of came up, and it was very logical. It was 5 days because I would like, somebody was speaking about having had a vasectomy, and they said that 5 days will have covered them for, a whole week's work off, which means that they get, 2 weekends. And that seemed like a good amount of time to be able to recover. And I thought that was quite a useful data point. So again, do speak to the people, on the team. Okay, wonderful. So I want to move to our final section. I'm conscious of the time, so we have about 15 minutes left. Do keep your questions coming. I actually haven't checked the Q&A in a while. We have one question, which I will share in a minute. But yeah, I just wanted to talk about essentially, the impact of having a policy. We've shared our policy. It's broken down into a few sections. We have the terminology, we have the resources at the end, because not everybody will want to chat about what they're going through. As we said in the beginning, there's still a bit of a stigma, and maybe somebody would like to just check out resources first, or do their own kind of research instead of speaking to HR or their manager, essentially. But starting by having a policy will have a positive impact and send the right signal to the organization that it is important to support all your employees, not just women. And you can start by downloading that. So Gidon, I'm going to ask you maybe a tricky question. So listen up. It's a bit of a call to action. So if everybody were to leave this call today, whether it's men, women, but around men's health, what is one actionable step that they can take to make sure that, we're getting one step closer to helping men in the workplace?
We should ask you to think about that before. It's a really hard one.
I'm sorry, it is hard. Okay, I'll give you a couple of minutes.
No, I kind of think, so just my first thought is kind of where I finished the last point, which was just equality, actually, okay. Just equality and acknowledgement that there should be a men's health policy. And maybe that's enough for, and even if it was just a couple of lines to say we need a men's health policy, men have health and well-being issues, and we need to have or develop a structure in time that we can refer to and account to. That's kind of where I would start, but I would just start from a degree of equality of importance, and then actually it's the importance, like where I started talking about, you can't take any aspect of human well-being in isolation, because we all live and work together, and the effects on relationships and work. You can't just do one bit and not do the all bit. So I kind of
Yeah.
think that's where I would start.
Okay, thank you. And Rob, does it mean if I ask you the same question, if you had to give, I guess, one piece of advice about setting something up that you think would be meaningful, would that be just by having a policy? Would it be something else to help, companies around men's health? I'm asking more from like a male employee working in actually a female dominated company.
Yeah, I guess my piece of feedback advice would be, I think what I've spoken to others about is don't give up. So a lot of people will say they run sort of employee surveys and things like this, and they just don't really get any interaction from men and just don't really get any insight into what men want. Again, we're just not very good at interacting with things. But that would be my piece of advice: just don't give up, because if you keep sort of not pushing too hard with sort of the policy specifically, but men's health in general, you will start to have that psychological impact in terms of people feeling more confident about speaking to the business. And I guarantee you, men do want these type of things. We might not seem like we do, but we do. So just, yeah, don't give up. Don't forget about men either, because yeah, I know obviously it's amazing to focus on females, and absolutely we should be doing that. But let's not forget about the physiological and mental side of men's health as well, which, as Gidon sort of referenced to some stats earlier, is super important too. So yeah, just keep banging the drum. Don't give up after sort of one try, because it makes a massive difference.
That's actually a really good point. Not just for men, but I think if you think of, people being diverse, whether it's neurodiverse or having their own way of absorbing information, I think thinking of different ways to put that information across can have a big impact. You may want to do a survey, you may want to send an email, you may want to send a video, you may want to do a group chat, keep trialing different things. And something will stick with specific people, because it's not a one size fits all approach. Gidon, I'm just resharing the link that you tried to share now about prostate cancer. Hopefully everybody can see it. So before we go, I did want to address things that are interlinked, and going back to you, Gidon, and I think we spoke about this at the beginning a little bit, is men's health and then mental health in general. Obviously, they go hand in hand. How can we as a company, build the right support for men in the workplace to ensure that their mental health is supported, their men's health is supported? Is it tied together that, if you have good men's health, you have good mental health? What are sort of the things that you've seen when you speak to patients, when you speak to our clients, that help people in terms of their mental health throughout any reproductive health journey?
I think I can't be the only one whose LinkedIn feed includes stories, personal stories, where people have dealt with suicide, and which is the most extreme thing. And there's one of the themes that always runs through this is the fact that people seem to be okay before the event. You see it time and time and time again. And so for me, there is this very extreme aspect of men's health. And clearly, you're not going to catch everybody, but if you encourage discussion, if you signpost for those people who feel they can't, and you continually readdress this, then you will help. Men's health also, improving the discussion on mental health will make happier people, better workers, and productivity will increase. You'll decrease the amount of sick days. You'll decrease the amount of time that people take off from alcohol and other drugs because of their dependency on them. One thing that we spoke about last week or the week before in our internal teaching sessions was about violence against women. And there is a clear association with men's health issues and violence against women. And this is something that's, really need to think about a lot. Because if men feel inadequate, men are unhappy in themselves and they don't have access to decent support, then they may turn to self-destructive behaviors and behaviors that are destructive to others. So I think it's very, very important. I think that, like many people, it's difficult to talk about the challenges and the struggles that we have, that everybody has mentally, but it's really difficult, and it's just opening up that discussion. And when you say to somebody, how are you, and they say you're fine, but are you all right? And I think everybody on this call is aware of the subtleties of human behavior that can give an inkling that somebody's not quite right. And really, it's up to us as managers of people to just watch and listen to our friends, colleagues, employees, to look at these very fine points. And I think there is a lot of learning that can be done to look for us and to try and identify early in the journey when people aren't well. So I think there's a huge amount that can be done.
Yeah, I agree. That's amazing. Thank you so much, Gideon. So we do have a couple of questions in the Q&A. I will invite you now to add any more, but this one I'll direct at you, Rob, if that's okay. The question is, if a company submitted its age demographic data, could you supply a male health top spec proposal? I think I know the answer, but I'll let you answer that anyway.
Sorry, can you just repeat that one more time? I just missed the first bit. Apologies.
So essentially, if a client is or prospective client would submit the age demographic data of its population, could you supply male health top spec proposal?
Yeah, we could do so. On a frequent basis with a lot of the prospects and clients that we work with, we generate what we call a health report. And what that will do is it will look into an organization's specific demographic information. So it'll look at their men and potentially the age of their men. And then what that will correlate to is we'll start to tie it together towards some of those statistics that Gideon was talking about earlier, but all of the credible sources that we've got access to. And what it will do is it will provide you with some real insight as a business. And maybe if you're executive teams that you're talking to about maybe implementing a policy or support around, it will give you a full sort of highlight of how men are currently being impacted in your business right now based on your specific demographics. And I present it at least a few times a week to the clients that I'm speaking with. And honestly, it's a little bit depressing sometimes, obviously, to show them just how many men are maybe going to die before retirement age, or how many men are suffering from testosterone deficiency or erectile dysfunction. But it is also super eye-opening to see reactions, and the realization sit in is just how many people are going through these journeys that are maybe not receiving the support or not feeling supported sort of in the workplace and at home. And I think it's really good. So certainly something that we can do. So if anyone ever wants anything like that, we can create that report for you.
Absolutely. And I've just taken the opportunity to put this QR code up. So if you did want to book a call or you wanted to discuss anything relating to men's health, to women's health, gender identity, neurodiversity, any type of reproductive health, we love talking about reproductive health and we're very passionate about it. So do give us a call. I will give 1 more minute for questions in case there are any, and then we can wrap up. So I'm going to go to everyone for kind of final thoughts. Let me check. No more questions at this time. So I think, right, men's health, very easy to start with a policy. Thank you so much, Gideon, for all your insights. I think it really brought to life why it's important to have these conversations. Obviously, we're really lucky to have you as a teacher in our company and to talk about men's health every day, really, not only in our teaching. So I think as a company, we're quite comfortable and we would love that to trickle into other companies and other people we work with. I think, Rob, you've been a great ambassador for TIFA internally in terms of raising awareness on men's health, giving us your perspective. And so long may that continue. But I want to thank everyone for attending and for their time today. And as we said, we're going to circulate a recording after the fact, but we're always here to chat on all things health, reproductive health. And yeah, we hope to see you at another webinar soon. So thank you, Gideon, thank you, Rob, and thank you everyone else.
Thank you. See you later, guys. Bye-bye.